Good morning, everyone. My name is Andrea Mendoza, and my topic is on ACL tear. Here are some fun facts. About 200,000 ACL injuries occur in the U.S. annually, in which more than half result in surgery. About 30% of the cases are due to direct contact, and more than 70% of the cases are due to non-contact by doing a wrong movement. Here's my athlete. His name is John Orozco. He's a 23-year-old gymnast with an ACL tear. A little bit of history on my patient. He's an American artistic gymnast who competed in the 2012 Olympics and is a 2012 U.S. national champion. He was selected to the U.S. Olympic gymnastics team for the 2016 Olympic Games, but unfortunately withdrew due to an ACL tear. Here's a little bit of background on what happened to John and a little bit of what happens in most cases during an ACL tear. ACL tears occur during non-contact situations that include excessive valgus, hyperextension, and abduction movements. For John and other gymnasts, ACL injuries can result when the gymnast lands short or are over-rotated while tumbling, dismounting, or bouncing. Unfortunately for John, he injured his ACL while landing after a high bar dismount. Gymnasts are more likely to tear their ACL when landing after jump, after sudden change in direction, or abrupt stopping. Some of the most common signs and symptoms are a loud pop or popping sensation in the knee, severe pain and inability to continue activity, rapid swelling, loss of range of motion, a feeling of instability or giving away with weight bearing. Often, the diagnosis can be made on basis of physical exam alone, such as Logman test, but you may need other tests to rule out other causes and to determine the severity of the injury. For John's diagnosis, an X-ray was ordered to rule out bone fracture, also an MRI to know the extent of the ACL injury and for any signs of damage to other tissues in the knee, including cartilage. An ultrasound could also be ordered in some cases. This is to check for injury in the ligaments, tendons, and muscles of the knee. In John's case, an ACL reconstruction surgery was determined to be the best option for him. ACL reconstruction allows return to cutting sports and high-demand activity. Here's some function and anatomy of the ACL. The ACL is a primary stabilizer of the knee. It limits anterior motion of the tibia and posterior motion of the femur. In extension, it limits varus and valgus stress, and it also limits hyperextension, internal rotation, and external rotation of the tibia. So here's a typical ACL rehabilitation timeline. The first phase would be the inactive phase. This is typically the first 2 weeks after surgery. The second phase would be the active phase, which is 2 to 6 weeks after surgery. The third phase would be the resistive phase, which is typically 6 weeks to 3 to 4 months after surgery. The fourth phase would be the aggressive phase, which is 4 to 6 months after surgery. And this phase is where we start working towards returning back to sport. Here's phase 1, the inactive phase. This is the inflammatory phase of healing. The goal during this phase is to minimize pain and reduce swelling. It is also extremely important to achieve full knee extension, range of motion as soon as possible, as well as to maintain condition of the non-affected body segments, as well as the cardiovascular system. The treatment recommended for my patient was the RICE method, which is to rest, to ice, compress, and elevate the knee. This is phase 2, the active phase. This is typically during week 2 and 6 after surgery. The goal during this phase is to improve range of motion and flexibility of the knee, to regain strength and to improve balance. Some of the exercises recommended during this phase were the knee extension and calf stretch, the knee slides, prone quadricep stretch, and hamstring sit standing. This is phase 3. This is the resisted phase. This is typically 6 to 8 weeks after surgery. During this phase, the goal is to restore and maintain deficient parameters such as strength, agility, and endurance. Some of the exercises recommended during this phase are stationary cycling, isometric at 60-degree knee flexion or greater, wall squats, and lateral lunges. Phase 4 is the aggressive phase. The goal during this phase is to restore functional ability to be able to go back to pre-injury activities. Some of the exercises that I came up with are side-to-side jumps, rotating box jump, 2-foot jump to single leg landing, and hurdle hop to box jump.